Hello, everybody. This is Gary. Today is Thursday, July 30th, 2020. It's 4:04 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is just an update on my schizophrenia treatment. Today, I went to see my psychiatrist in person for the first time in about 5 months. Up until this point, I was doing telephone conferences with my psychiatrist. And in that process, I got a new psychiatrist that I had talked to on the phone for consultations, but until today, I haven't physically met him. So I met him today. The meeting went well. We didn't change any of my medications. We just talked about my hospitalization last week for 3 days, which was based on paranoia and hallucinations getting increasingly bad. Since then, I've been doing pretty well. Haven't felt the need to go to the psychiatric emergency room, and it was finally good to meet my psychiatrist in person. Um, it's easier to establish a relationship with somebody in person on a professional level than it is to try to do that over the telephone when you haven't actually met that person. Um, we didn't change anything. We didn't change my medications. We agreed that I could see him in about 3 to 4 weeks. So I have to call to set up an appointment with him. When I went into the clinic, they were doing social distancing and required masks and hand sanitizer. Um, the waiting room has a bunch of seats in it, and they were marked off in the seats you could sit in and the ones you can sit in. It was designed to keep people from sitting next to each other directly. Um, their idea of social distancing. At first, there wasn't a lot of people at the clinic because I got there early, around 8:30 this morning. My appointment was at 9. Um, I didn't have to take the bus. I was able to get a cab to and from my appointment with Medicaid, um, which I also have Medicare, but Medicare doesn't pay for cab rides. It's kind of tough to take the bus out there because my clinic is on the other side of town, and I have to go downtown to downtown Rochester at the transit center, then take a bus from there out to the suburbs where my clinic is. It's just a lot easier to take a cab if I can arrange it. I can't always arrange it. Sometimes my Medicaid isn't active. Depends on the month. It depends on how many medical bills I have for that month. But we did talk about my smoking cigarettes, and I'm down to about 4 cigarettes a day. Um, about 8 days ago, I was still smoking 1.5 pack of cigarettes a day, so that's an improvement. I am using nicotine gum, which I'm chewing on right now, and I am using the nicotine patch, 21 milligram patch, released over 24 hours. I have a nicotine patch kit, which over 8 weeks goes from 21 milligrams to 14 milligrams to 7 milligrams to ease one off nicotine addiction. Um, but the problem with that is I haven't set a quit date. Um, so I'm not sure when I'm actually going to stop smoking. I kind of described it to my psychiatrist by saying it's like an old friend who was never really a good person to have as a friend, but they've been around so long. You get used to them, and it's kind of hard to get rid of them. Well, that's the way it is with smoking. I'm not quite ready to totally quit smoking, and I'm not sure when I will be. But like I told my psychiatrist, I was worried that within a few months from now, if I kept smoking 1.5 pack of cigarettes a day, I would have severe breathing problems and end up on oxygen, which I don't want. I've seen older people on oxygen. It's a pain in the ass. You have to carry around an oxygen tank with you um, at all times, and you're always worried about whether or not you're going to run out of oxygen before you get to the next tank of oxygen. So I didn't want that, so I reduced my smoking. Um, he did a basic physical exam to see if I had any rigidity in my muscles or tremors. Some psychiatric medications can cause your muscles to become rigid, or you might have tremors from the medications. Right now, I don't have either of those problems, so I guess that went well. Um, Not much else to talk about. Things went well today. Uh, Today's a nice day. I went outside and rode my bike today. Um, did some consumer surveys, which I do for extra money, doing this video. Um, Feeling pretty good right now. Um, Hallucinations aren't so bad right now. Paranoia is not so bad right now. Um, if I feel like I am losing control, I will take a Haldol pill, which is an antipsychotic, and a Klonopin, which is anti-anxiety. If I take them together, they usually prevent me from going to the psychiatric emergency room, especially if there's psychotic paranoia and hallucinations along with anxiety involved in that. Um, I don't know if I'm catching a cold or not. Um, but things are going well. Hope they continue to do so. Um, can't get a refill on the Klonopin until next week because I get 6 pills every 2 weeks, half a milligram each. Because I do have a history of abusing Klonopin, Xanax, Ativan, that kind of thing, Valium, Librium. So they restrict how much Klonopin I could get every 2 weeks. I had agreed with my previous psychiatrist that it would be 6 pills every 2 weeks, and the psychiatrist I have now has agreed to stick to that schedule. But not much else going on. Comment, like, share, subscribe. Press the notification bell if you want to know when I put out new videos. And if you really, really, really want to help out my channel, share this on social media like Twitter and Facebook. I don't ask for money to do these videos. I just ask that you share them. Um, if you have any ideas you want me to do for a video topic, let me know in the comment section.